Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
If you're just joining us, we are talking about bladder issues. We've already heard that when you need to use the restroom, go. Don't hold it. And let's go now to some of our viewer questions. Aubrey from Telefofo writes, Doc, I've heard I have a small bladder and that's why I have frequent leaks. Is this true?
It could be true. There are people that are born with a small bladder, or for some reason their bladder is not very large. It could be true, but it's much more likely that you're having the stress incontinence that we talked about earlier, where the muscles are weak lower down, and so it's difficult for you to control your urination. And there's something called Kegel exercises which you can do, and these are exercises where you halt the urination. So you're at the bathroom, you're going to the toilet, and then you will stop the flow, stop the flow, stop the flow, stop the flow, and by interrupting the flow you're teaching your brain to control those muscles again and making them stronger. It's like weight training for your pelvis. So that's something that you can do. You can look up the exercises on the internet, and they're very helpful. They help.
Sally from Agana asks, I often use the restroom 2 or 3 times a night. Is this cause for concern? And we actually received, I know there was a Jose, I think, from Dededo. We received this question from several viewers, I guess, who have this problem, and they want to know, is it a concern, and what they can do to try to avoid.
It's really important because when you have to go to use the restroom at night, of course you're interrupting your sleep and you're not getting a good night's sleep. The thing that comes to mind first of all is diabetes, because it's one of the most common symptoms of diabetes is frequent urination at nighttime. So please get your sugar checked. Otherwise, sometimes it's related to drinking too much alcohol in the evening time, or just even too much fluid of any kind. So you might consider cutting back on your fluids, meaning stop drinking anything after 6 p.m. and make sure you use the restroom before bed. Infection could be another reason, so I think you should have it checked out.
Okay, Lerner from Tumon asks, do I really need to drink 8 glasses of water a day?
Well, depends on what you're doing, but 8 is a reasonable number. In our climate, you may even need more, but what I always tell patients is drink enough so that when you use the restroom, your urine is clear. It's not yellow, it's not a dark color, it's just a nice, clear, fresh color.
Okay. Matt from Sinahania asks, is it possible for my child to get a UTI?
It is, and it's quite common actually in little girls. They have to learn to wipe from front to back after using the restroom, and if they're wiping the other way, they may be bringing germs from the anus over into the front of the urethra and contaminating and getting infections. That's the most common reason, is hygiene, so we need to teach our children to wipe. But sometimes children also hold their urine, and other times they're born with what we call congenital or inborn errors, where the pathways, the tubes aren't quite right, and so there'll be something called reflux, where the bladder doesn't just hold the urine, but it sloshes back up to the kidneys, and then that needs to be treated because they will keep getting infections and damage their kidneys. So especially if it's a young child under the age of 5 with a urinary tract infection, they need investigation.
Okay, Jose from Jutnya asks, I'm always running to the bathroom. Should I be worried that I have an enlarged prostate or just an overactive bladder?
Yes, good question, Jose. As far as that, it depends on your age group. If you're over 40 and you're a male, you may have an enlarged prostate. And the prostate gland sits around in the lower part of the pelvis. It sits around the urethra. So if it keeps getting bigger and bigger and bigger, it presses on that tube, and it's very difficult for people to urinate, especially men at nighttime. So if you're over 40, yes, please get your prostate checked. And if you're under that and you're using the bathroom frequently, again, diabetes would be the top idea that I have, or maybe an infection.
Okay, Sharon from Barracuda asks, I just had a baby and I can go all day without the need to urinate. Is this normal?
No, I don't think so. If you're breastfeeding, maybe you're getting a little dehydrated. I'm not sure. It's quite unusual, but it sounds like you're holding your urine, and I would put yourself on a schedule. When we're young mothers, we're so busy, we forget to take care of ourselves, so maybe put an alarm clock, and every 3 hours at least make it to the restroom.
And our last question comes from Phil from Ordit asking, I drink coffee and soda. Is it true it's a bladder stimulant?
And even a bladder irritant for some people. Some people have a condition called interstitial cystitis, which is an irritation of the bladder. They've constantly needing to use the restroom, and they have a lot of pain and discomfort. And yeah, soda, coffee, tea, they tend to irritate the bladder. They also fill the bladder more quickly, so you might want to avoid those.
All right, any last words of advice that you'd like to give to our viewers about this issue?
I think as far as the urine, it is very important to recognize that it's a natural function. It needs to be taken care of, and don't be embarrassed to seek help if you're having issues with it. Many people are so ashamed of incontinence, but it's often something that is treatable. There is medication to help you if these other measures we talked about don't help, and we hope you can help. We can get you help.
Now, do you need to go just to your regular physician, or do you need to go to, let's say, a urologist?
We do have a urologist that's a specialist for the urinary tract on Guam, but for most things, your family doctor can help you.
Okay, Doc, thank you again for coming in. We always appreciate
welcome.
the information and advice. Dr. Lom will be back again next week, and we'll be talking about scars and wounds. You can send in your questions to healthyliving@KUAM.com, or you can post your question on our Facebook page or, of course, on our website. We are back with more Healthy Living after the break. Stay with us.